We have gotten a number of thank yous, Meg and I have, for being involved in these, but without their magic expertise in the technology area, these wouldn't happen. So I do want to say thank you to those staff who make this happen. Just a quick update on our data. We have now topped 80,000 cases today. We have 721 deaths and unfortunately 63 outbreaks. The number of outbreaks that we have been consistently high since before the holidays, and that is not changing at this point. What is slightly changing at this point is that our positivity rate is down a little to 12.3%. Our case rate is down a little to 477 per 100,000, and our hospitalizations are down a little. I want to emphasize the little part of this because we know that they're moving in the right direction. That's what we want to see happen, but at the same time, we have to watch these very carefully because we know that can change quickly. The one thing that's really not down very much are the number of deaths that we're experiencing in Mecklenburg County. The last several weeks have been the worst we've seen so far in terms of number of deaths in our community. So again, just continuing to reemphasize the fact that we still have a lot of virus in Mecklenburg County, and a lot of people are being exposed to that virus and are becoming ill. There continues to be confusion around eligibility for vaccine. We continue to have conversations with the state about this, and I want to reassert the fact that we are focused in Mecklenburg County on groups 1 and 2, and we'll continue to do that until we get further direction from the state. Right now, the availability of vaccine continues to be the challenge. There's just not enough to go around, and we're continuing to advocate with the state for more vaccine coming into our community. So that being said, I want to reinforce the need for us to continue with our prevention efforts. They couldn't be more important than they are right now. It's going to be some time before we have the impact from vaccines that we want to have. So people need to continue to wear a mask, stay away from each other as much as possible, stay home as much as you can. We really don't need people out and about in our community if they don't need to be. We just have too much virus, as I mentioned earlier. So now I'd like to turn it over to Dr. Meg Sullivan, our Public Health Medical Director, who will give you an update on vaccine.
Thank you. And just first to echo everything you just said about just how important it is to continue to focus urgently on prevention, just given the level of virus that we still have in our community. So just to provide a brief update around vaccines. So again, starting with quick numbers, as of yesterday evening, Mecklenburg County Public Health here have administered almost 10,000 doses of vaccine, which includes over 9,000 first doses and over 900 second doses. Again, as Gibbie mentioned, we continue to vaccinate individuals in groups 1 and groups 2 as per current North Carolina state guidance. And reminder, group 1 is healthcare workers with current in-person patient contact and long-term care facility staff and residents. And group 2 is our older adults, which includes individuals ages 65 and older, regardless of health status or living situation. For the next few days here at the health department, we have a very busy schedule when it comes to vaccinations, and I wanted to take the opportunity to highlight some of the work we will be doing. So today we have over 450 appointments scheduled as part of our regular first dose clinic here at Bojangles, and we are providing second doses through our clinics with StarMed here at Bojangles, as well as our medic and fire partners at Medic Headquarters. Today we are also partnering with both of our federally qualified health centers to provide vaccine to eligible patients ages 65 and older. We are partnering with one of our shelter agencies to provide vaccine to eligible staff and residents over the age of 65 at one of their shelter sites, and with the Mecklenburg County Jail to provide vaccine to eligible residents and some of their Group 1 healthcare providers. Tomorrow, in addition to our first and second dose clinics at Bojangles, we'll be partnering with a community provider on the east side of Charlotte to provide vaccinations to eligible community members. And finally, on Monday, in addition to our first dose clinic at Bojangles and our second dose clinics through StarMed and Medic and Fire, we will be working with Livion, which is formerly Charlotte Housing Authority, to begin to provide vaccinations for eligible residents in groups 2 at 3 of their sites. I'm incredibly proud of the work of our team and our community partners to be able to put this all together. By the end of the day on Monday, we will have administered all of the first doses that we have received to date. And we learned this morning that we will be receiving only another 1,950 doses of Pfizer next week here at the health department. Therefore, our vaccine administration next week will definitely be limited by the supply that we receive. And we are working to administer vaccines both at the Bojangles Clinic and the community as we work to reach residents, and especially in communities that have been disproportionately impacted by COVID. But as Gibbie referenced, it is limited by current supply. We were able to open up some additional appointments in February yesterday morning, and those appointments did quickly fill up by the middle of the day. And as we learn more about vaccine supply and allocation, we do hope to be able to open up more appointments and or do more community vaccination events, again, continuing to prioritize those individuals and communities disproportionately impacted by COVID. We also do recognize the frustration in the community for so many residents who would like to make an appointment but are unable to do so due to the limited supply. We really appreciate your patience with the process and again recognize the incredible work of our hotline staff who are working to respond to every call and voicemail to the extent possible. Then finally, we do remain really focused on disseminating accurate information about the vaccine, including the safety and efficacy, who is currently eligible, and how to make an appointment throughout the community. We recently developed new resources, which include vaccine information for individuals ages 65 and older, and a joint flyer with Atrium and Novant regarding how options to make appointments for a vaccine. These resources are available in English and Spanish on our website and will be available in multiple languages in the very near future. We also continue to collaborate closely with both hospital systems to ensure consistent messaging and work to coordinate our efforts for vaccine delivery in the county. And finally, I always end by saying throughout our vaccine distribution planning and response, equitable distribution in our community has been and will continue to be a central focus for our efforts. Thank you.
First question today goes to Brett Jensen, WBT Radio.
Thanks, guys, once again for doing this. We really do appreciate it, I can assure you. Two quick questions, I think one for each one of you. Gibbie, in terms of the deaths, because you said they're still relatively high, in terms of the deaths, are they still coming from the nursing homes like they were early on in the process, or is it still the same age range, or where are they coming from?
So we continue to see probably about close to 50% of our deaths coming from our long-term care facilities. That has been consistent throughout, but that means that the other 50% are coming from the community, from different populations within our community. So again, our individuals who are living in long-term care facilities are at high risk. And once that that virus is introduced into that setting, they are quickly exposed. Many of those folks have other underlying health conditions and are much more vulnerable to severe illness and death than others. But as I said, only 50% are occurring in that environment. The rest is in the community.
And Dr. Sullivan, I don't know if this is you or Gibbie that would be answering this, but in terms, like we heard Dr. Cohen say yesterday, and she wouldn't say exactly how much, but she did admit that some of these vaccines are having to be thrown away due to the expiration dates or whatever. Are you aware, or Gibbie, are you guys aware of any that are being thrown away here locally in Mecklenburg County? I know you don't have access to Walgreens and CVS, but are any of the hospitals, or are you guys experiencing any of that?
We have not thrown any vaccine away. We have been very careful with the vaccine, making sure that it's administered appropriately. But if we end up at the end of the day with a couple of doses left over, we make sure we find an arm to put it in. So we are not wasting vaccine. And we've heard the same thing from both of the hospital systems. So I don't believe that's a problem here. I don't have firsthand knowledge of any other situations at this point.
Next question is Claire Donnelly, WFAE.
Hi there, Claire Donnelly from WFAE. Thanks for doing this. So we heard yesterday that the state is going to be sending about $2.5 million to transit agencies in the state to help people get to their vaccine appointments. Are any of those dollars coming to Mecklenburg, and what does that mean for residents if so?
So we do know that those dollars are being funneled into organizations that already exist and provide transportation for certain populations in our community already. Our MTS services through our DSS department at the county level, but we're anticipating some of those funds will come through the CAT system as well, and there may be other opportunities too. We were already working with both of those systems to help us with transportation for folks to get to the vaccine, and already have things in place. It just means now that they're actually going to be reimbursed for those dollars. So both of those systems are working through the details with the state around how to access the funds, but we do anticipate some of that coming to Mecklenburg.
Do you have any estimate on how much that would be?
I do not. In all of the documentation that I've seen come through, there was a dollar sign related to that. We probably have to get that information from both of those systems to see if they've been given an actual amount or whether it's service they have to provide and then they bill for it. So I'm not exactly sure how that works.
Great, thank you.
Mm-hmm.
Next question is Derek Dellinger, Fox 46.
Thank you for taking my question. We have had some people reach out to us, and some say they're asking this question: why open it up for more vaccine, or why open it up for more people if you don't have enough vaccine? For those that will say that, and for those that will hear this, can you explain kind of the reasoning on opening it up more, despite the fact that there is not enough vaccine that's out there right now?
Well, we have been encouraged by the state to be prepared for vaccine each week. We don't know each week what we're going to get until we got our allocation, the number that we can expect to get next week. We got that number last night. So we don't have a lot of planning time. The state's encouraging us to be prepared to push it out as quickly as we can. And the state is also wanting us to, as Dr. Sullivan mentioned, wanting us to get that vaccine out in the week that it's given. Because the federal government is looking at what the state is getting out. The state is looking at what we're getting out, because that will determine future allocations. If you're not able to get it out, you're not going to get as much. So we are doing this on a week-by-week basis. And, if we don't make appointments a little further out, then we won't be prepared when the vaccine does come. So we're trying to be hopeful that we will continue to get the same amount of vaccine at the very least. And if we have more, we're prepared to address that and deal with it so that we can get the vaccine out. The other reason we've done this, appointments have worked really well for us, so that we don't have long lines of individuals waiting to get vaccines, especially when you're talking about the elderly. It's hard for them to stand in line. It's hard for them to spend long hours in a car. If we can do this by appointment and be efficient and effective with it, that's what we're going to continue to do.
Next question goes to Allison Kuznets, Charlotte Observer.
Hi, Gibbie. It's Allison from the Observer. You mentioned that a few of our numbers are down a little bit. Can you talk about what does that mean as far as our hospitalizations? Is it too soon to say we might have peaked, or how many more days or weeks would you need to see that trend before you could assess that? And also, does it seem that with our numbers beginning to improve, that CMS is in better shape to bring students back to the classroom in mid-February?
Thanks, Allison. I guess what I will say at this point is that it's too early to tell. What we're starting to see is a slight downward trend in our numbers. We are hoping that those numbers will continue to move in that direction, and the faster the better. But at this point, it's a slight trend, and we've seen before those slight trends going away and numbers moving back up. So we're hesitant to start making decisions based on what we're seeing right now. We're just very hopeful that it'll continue to go in that direction. In terms of the schools, I think it's a little early for us to be making judgment calls on where these numbers are going to go. We need another week or two to take a look at that.
Next question is Kendall Morris, WCNC.
Hi, Gibbie. It's Kendall with WCNC. We've recently seen some videos from a worship service this week at Elevation Church in Valentine. People are packed closely together, and I couldn't see a mask in the videos that I've seen. Elevation Church has said that they tested all 195 attendees and that anyone positive went home. A couple questions related to this. Number one, is the county aware of this situation? And is this a responsible situation, or does the testing create a false sense of security? And what is your recommendation for this church and for churches?
Great question. We are aware of the situation, and we have had conversations with them and are continuing to have conversations with them. Regardless, as we've said before, a negative test is a point in time. That does not mean that that person could not become infected or is not already infected. So we are not recommending that they continue with that activity. Obviously, it's their amendment rights to worship in the way that they see fit, but we are asking them, as we've asked everybody else in our community, to wear masks, to socially distance, and not to gather in large groups. We'll continue to work with them as best we can and encourage the right behavior. At this point, we have not seen any clusters or outbreaks from that church, and we're continuing to watch that carefully. That's about the most we can do at this point.
Next question, Vanessa Ruffes, WCNC.
Hi guys, hope you're doing well and thanks for taking my question. Actually, I have a two-parter here. I wondered if y'all were in a position now to release any more information about that pediatric death. I know you couldn't release a lot of information before, but I have been getting a couple comments from viewers who just wanted to know if there were any, underlying health conditions, or if we could get a more, more specific age range for that child. And then my second question, I noticed on the statewide cluster report that was released this week that there was a note on it saying that due to the widespread transmission of the virus, that some of the cluster contact tracing kind of limited in scale. And I was wondering if you're seeing a similar concern, not being able to keep up with all of the viral spread that's going on as far as contact tracing. And I guess maybe at what point for your percent positive would you anticipate being able to get that more under control?
Thank you for those questions. What I will say about the pediatric case is we are not releasing any information about that specific case, and that is standard practice for us. The same goes for if it's a death from a flu case. We do not release that level of information on pediatric cases. So I would not expect any more detail around that particular case. In terms of case investigation, we've gotten continued ongoing guidance from the state about how to focus our case investigation and contact tracing processes. Right now, the state has indicated to us that the biggest priority for us should be getting vaccine out, and so we're making sure that we're doing that. But we also provide targeted contact tracing and continue those services as we have before. I'm going to ask Dr. Sullivan if there's anything else that she'd like to add to that.
Yeah, I think it's a great question. And obviously, as we have both pointed out, we have an incredible amount of virus in the community and a lot of people testing positive, which definitely does stress the case investigation and contact tracing systems. But our case investigators and contact tracers are still working 7 days a week. We're still making attempts to notify individuals, especially those that have recently tested positive, those that work in or live in congregate living settings, including our long-term care facilities, our people under the age of 18, due to school and childcare reasons and other kind of known clusters or outbreak settings. So we're still making attempts to reach out and making extra attempts to reach out for those prioritized populations. The same thing with our contact tracing. But I think it does underscore, again, the urgency around getting down the level of virus in our community. I think right now when we talk about contact tracing especially, it's really to identify those individuals who are now at increased risk due to exposure. And as Gibbie has said many times, at this point, the level is so high that if you're out and about, you can assume you've been exposed. And so while contact tracing allows for that individual level identification, I think we all have the responsibility to recognize that we have the risk of exposure and to act accordingly.
Next question, Eric Spanberg, Charlotte Business Journal.
Good afternoon, Gibbie. This is Eric Spanberg with the Business Journal. I want to ask you a couple things on the private sector collaborations that we have that involve the Speedway, Honeywell, Tepper Sports, and so on and so forth. I think also the Hornets are working with Avant and Train. How much does the county collaborate on those? And then secondly, are there other ways that you could see the private sector getting involved and maybe helping accelerate this effort?
Great questions, Eric. We are in constant conversation with both hospital systems about their efforts, our efforts, and how we can all work together on this. Obviously, our hospital systems have more capacity than the health department does with the number of people that they employ. And also, especially Atrium has received much more vaccine than we have, so they have the ability to do some of these large events. We work with them, we provide support for them, we provide guidance, and we'll continue to do that as we move forward with this process. We're meeting weekly with them at least, quite often 2 or 3 or 4 different conversations during the week around these issues. I've been quite involved with Bank of America and Atrium in conversations about what their plans are for next weekend. The other thing that I'll point out, and I want to continue to remind people of, is that our hospital systems are regional systems. So when they provide services, they're providing services for more than just Mecklenburg County residents. And that makes it even more challenging for us sometimes to know what the vaccine is that's coming into our community, how much of that is really for Mecklenburg County residents, and how much of it actually gets in the arms of Mecklenburg County residents. So we're continuing to work with them and try to do what we can to focus our efforts on our Mecklenburg County folks. And secondly, we are constantly having conversations with other potential partners in the community to help us with vaccines. We have a lot who are interested, a lot who work with some of the minority populations that we've talked about that need to get vaccinated. And all we're looking for is more vaccine to be able to get it out to these folks and to get their help in getting the vaccine to the right people. So we're continuing to develop those relationships and be poised to be able to do it once the floodgates get opened with vaccine. But right now, unfortunately, we're more at a trickle than a floodgate. So.
Next question is Reuben Jones, Spectrum News.
Yeah, hi, good afternoon. This is Reuben over at Spectrum News. Just wondering if you could give an update on how your staffing levels are doing at your vaccination sites in terms of, are you needing more people to help give those vaccines, and who is typically giving them? I know you've worked with paramedics and things like that. What's kind of the update there?
Yeah, and it is a good question. I mean, I think that's something that obviously our kind of leadership has been working really hard on to make sure that our vaccination sites are appropriately staffed and I think incredibly efficient, which is something that we're really proud of. So right now we are using a mix of staffing, which includes public health staff. So we do have many nurses that are employed through public health, including our school health nurses and many of our case managers, as well as our clinic nurses. And some of them are working extra days or, volunteering to be part of this exciting effort. We also, as you mentioned, have partnered with our EMTs and paramedics through our medic, as well as our city, town, and county fire departments, and they have been incredible partners. We do a very specific training with them, and they have been sending people pretty much every day to our clinics, as well as we talked about, the second dose clinic. In addition, we have hired some staff, some nursing staff, as well as have started using volunteer nursing staff as well. So we anticipate right now we're doing well, but unfortunately, as we said, we're not getting a lot of vaccine. As vaccine comes more in, we are prepared to continue to utilize our staff to get more staff and make sure that we are able to continue to get vaccine out as quickly and equitably as possible.
And if I could just follow up real quick, thank you for that. Gibbie, I'm just curious, I think you might have gotten asked about this about a month ago or so, but just curious how your health department is doing in terms of staffing. Obviously, they're working grueling hours for the past year or so. Are you having issues with turnover or anything like that?
We've not seen any significant increases in turnover. I think that our staff is incredibly committed. It's absolutely amazing what they've accomplished over the past year, and it has been a year. I mean, it is hard to believe that we have been through almost a full year of this. But they, like I said, they're incredibly committed. Meg said, I had an email from someone this morning saying, can I volunteer to work on the weekends? So we have staff who are stepping up in all kinds of ways. Are they stressed? Yes. Are they tired? Yes. And we're doing everything we can to make sure that people have some time off and that we're recognizing when they really need to get away. So we are continuing to do the things that we think we need to do to support our staff. Could we do more? We'd love to, but it's an all hands on deck situation right now with us, with all of the different activities we have going. And I could not be prouder of the staff of Mecklenburg County Public Health.
Gibbie, Wednesday night, this is Brett Jensen again. Wednesday night, some of the county commissioners were extremely critical about the hours for the park being from dawn to dusk. Did they reach out to you, or have you reconsidered maybe possibly altering the hours of the local parks?
So I'll say a couple of things. Number one, I have been getting multiple emails every day about the concerns around parks and sports. And we've had several county commissioners who have been fairly vocal about this as well. I appreciate where they're coming from. I understand the importance of sports and physical activity, especially in a situation like we've had for the past year. But at the same time, I continue to reemphasize, we are at a critical stage right now. Our numbers are still extremely high. And if you go outside your house, you are taking the chance of being exposed to COVID-19. And that will continue for some time. So I have not reconsidered. I have not made all of these decisions on my own. Obviously, I don't control other departments in county government. The decision that to not have the lights on in the park were joint efforts, joint discussions that were had, but decisions that were made by our Park and Rec department. The decision for the schools to stop sports for a short period of time was made by the school board. It was not made by me, but it was made with recommendations from local public health that people need to stay at home right now. That is the only safe alternative that we have at this point in time, and that is what's going to help us get our numbers down. So we are continuing to stick with the directive and are continuing to ask our community across the board to do the things that we've asked them to do, to stay at home unless it's absolutely necessary, to be out, to wear your mask, to socially distance, and to help us get these numbers down so that when we do open up, we will be able to do it more successfully.
This is Derek with Fox 46. Question real quick about the potential, at least, of the Johnson & Johnson vaccine. The news that has been coming out of the past couple of days indicates not only is it a one shot, but it is also heading to the FDA for approval. How much could this change, essentially, what's being done in Mecklenburg County, and how hopeful are you at this point, I guess, for this approval?
We're incredibly excited. We want all of the vaccines to be out there. It will only help because it will increase the availability of vaccine. That particular vaccine will be easier for us to get out into the community. So we're incredibly excited and very hopeful that this will happen quickly and that it will start being distributed widely so that we can again expand the ability to get vaccine into the arms of people in Mecklenburg County.
Can you give me any insight as far as what you know in terms of, we know that Pfizer and Moderna have to be frozen, essentially. Do you know anything in regards to, other than the fact that it's one dose, at least for Johnson & Johnson? Have you been able to take a look at any of the specifics that will have to be, I guess, in terms of storage?
Yeah, so per our current understanding, I think it just requires refrigeration. I think all vaccines we have to recognize there's always storage and handling considerations, and always have to be incredibly careful with every vaccine that's out there. But as you reference, it does have significantly less stringent or problematic storage requirements than the other two. But I think we'll learn more as the data comes out.
Any more questions? All right. Thank you, everybody.
Thank you for being with us today.
Thanks.
Thanks, guys.